So today we are going to study about an important topic that is called cholelithiasis. Cholelithiasis, it is nothing but gallbladder stone. Okay, cholelithiasis, it is nothing but GB stone or gallbladder stone. So basically, it is a common and very easily seen nowadays. Okay, it affects mostly 5 to 15 percentage of population. Nowadays it is increasing day by day. Okay, so basically what happening that we have liver. Okay, and in the posterior level we have gallbladder. Okay, okay, so basically this is the liver and this is gallbladder and these are the pancreas. This area is duodenum. Okay, initial beginning of duodenum, and this is hepatic duct, this is cystic duct, and this is common bile duct. Okay, so basically liver will produce a bile juice. Okay, bile juice according to the requirement of the body, and it will come enter into the gallbladder. Okay, and it is stored. Initially it is stored, later it will become concentrated. Okay, so whenever requirement of the bile juice to digest the fatty substances, okay, the gallbladder will release amount of bile juice to digest the fatty substance. Okay, so this is the basic function of gallbladder. Is store the bile juice and concentrate the bile juice and release whenever requirement of bile juice in the duodenum through the common bile duct. Okay, so what will happen in cholelithiasis or gallbladder stone? What will happen? The two things will happen. It may be the concentration will excess. Okay, excess concentration will happen, first thing. And second thing, it will reduce the concentration. Okay, first is excess concentration is less, decrease the concentration. Okay, this will happen. Why this is happening? There are the reasons. We have number of reasons. In that we have infection, primarily due to the infection of liver or gallbladder or GIT. Okay, any infection. Okay, so because of the infection, it will absorb the large amount of bile juice and it will excrete large amount of salt rapidly. Okay, so what will happen? The concentration will arise. Okay, if the due to the dust infection only, the concentration will decrease. Next is s- second one is stasis. The second reason is stasis. Okay, what is meant by stasis? Stasis means whenever you are getting to eat the food. Okay, you are getting to eat the food, so you are taking the amount of fatty meal. Okay, you are eating fatty meal, but the amount of bile juice is not getting to digest this fatty meal. So what will happen? The large amount of bile juice will stored in the gallbladder. Later on, it will convert into the stones, hard material, hard substances. Next, we have third thing, high bile cholesterol. Okay, means that the whatever bile juice is there in the bile juice, what are those the substances? We have uh, sodium, means here salt and water and other substances. Okay, other metallic substances. So basically, in that the salt amount is it may be increase or maybe it is decrease. So what will happen? High bile cholesterol means in the sodium or any other other than water, other materialistic substances are increased. So that's the reason the stones or the things are becoming harder, and it will taking the it will reach near to the stones. Okay, so here it may be infection, it may be due to the diet, it may be due to the high level of low level of water substances or high level of materialistic or uh, material substances. Okay, solid substances. Okay, so here cholelithiasis means GB stone. So in every nearly the increase the 5 to 10% of population having cholelithiasis. Now it is increased to 15%. So basically, liver will release the bile juice. We have hepatic. This is the pathway of bile. Okay, first it will enter into the gallbladder. It will store, it will concentrate, and it will release according to the requirement. Then, what where it will release? It will release into the duodenum. Okay, but will have what will happen? The concentration will excess, or sometimes the concentration will decrease. Why it happening? Because of the infection or diet or decrease of liquid substance and increase of solid substances in the bile juice itself. Okay, so this is the reason and what the reason behind the uh, gallstone. How many types of gallstone are there? Okay, they are one type is cholesterol type, cholesterol type stones, and another one is pure pigment stone. Okay, and we have mixed stones. Third one is mixed stones. Okay, first is cholesterol type stones. They are single mostly. Okay, they are yellow in color. Okay, in this they are they are silent. They appear silently. Okay, if the size is bigger, then only the patient will understand they have galls. Okay, these are pure pigmented stone is small, mostly small, and they are multiple because here single. That's the reason it will become large. Then only the patient will get pain, and it is the main pure pigment stone is main bile stone. Okay, this is you have to remember, and it is mostly greenish color. Okay, so cholesterol type stone single yellow, and this is if it will increase silently, and pure pigment stones this is small. Excuse me. So pure pigment stones are small, multiple, and it is purely bile stone, and they are greenish color. Okay, this is the three things you have to remember in the mixed stone. What is mixed stones means? It may be cholesterol type, it may be pigment type, it may be calcium type, okay, cholesterol type, okay. It is depend upon the nature. You will get the uh, structure, like small, like single, like multiple, or bile, or greenish color, or yellowish color. Okay, so this is the three types of stones here: cholesterol, pure pigmented, and mixed, and we have mixed types. Now, what are the clinical features? Okay, what are the very very important? You have to remember this. Okay, and what are the main clinical feature is the pain. Okay, and one thing I have to tell you that it is more common in female than male. It is more common in female than male. Okay, and what are the another reason behind it? This is also sedentary life. Okay, lifestyle, using of excess oil in food, uses of excess fatty substances, and third thing is that getting delay for eating food. Okay, not taking uh, food on time. Okay, because gallbladder having large amount of space. Okay, this is like pouch. So when when you will get large amount of stone, or it is behind the entry level of bile juice, if there is the stone, then only you will get the pain. Okay, and secondary, if the bile juice is not secreted properly, what will happen? Your fat substances will not digest properly. To digest fat substance, we need bile juice compulsory. So first symptoms initially they will get dyspepsia, okay, and indigestion, okay, and another or constipation, and we have sometimes the patient have flatulence. These are the common GIT symptoms will appear, but last is the pain at high right hypochondric region. I will show you on picture. Okay, it is behind the right shoulder. Sometimes it will reach to the right shoulder also. Okay, this is the thing. I will show you a picture. This the pain is will appear. This is the main symptom, and you have the diagnosis through the ultrasound, USG of whole abdomen. Okay, this is the primary. You can see that, and you can see LFT, liver function test, or serum bilirubin level to see the function of the liver. And if they are high level of gall GB stones, what advice to remove the gallbladder? What we'll call cholecystectomy. Cholecystectomy will done to remove the gallbladder stone. Okay, and you have one another the scanning, that is cholecystography. Okay, sometimes a doctor prefer that. Okay, now I will show you the picture of the pain in the right high hypochondric region. So you can see that this is the right side high hypochondric region, the severe unbearable pain. Okay, you can see that these are the gallstones. So initially you have small size yellowish color, these are, but above all that you have the large stone. What it will do, it will compress and it will not able to release the bile juice from the gallbladder. So this is the very painful situation. So in that condition, patient have severe pain, sometimes vomiting, indigestion, unable to sit, unable to stand, unable to lie down. So he will get torture. Okay, so at that time moment, patient will rush to the hospital and they will do the scanning and advise for surgery. So patient that condition he cannot bear, so he will do surgery. Okay, so this is the thing about gallbladder. Now we'll talk about the treatment part in electrohomeopathy. So basically, that one thing we have to remember that if it is the gallbladder is not, sometimes some doctors will tell that the gallbladder will, what will happen? Gallbladder will burst. So the bile juice will come outside and it will infect the uh, or other organs. It may be happen, it may be not happen. Okay, it is not confirmed. So basically, it is on depend upon the patient condition. Okay, he if he have large amount of gallstone, okay, and he will not want to take any other therapy and other treatment. Okay, he can go through the surgery if he can bear the pain, and if he want to take the treatment in other pathies, he can take the treatment and he will get the benefit also. Gradually the stone will dissolve because they are not a stone which is coming from the outside the body. They are, the body itself is preparing. So if you give the medicines or treatment or remedy, body itself dissolve the stones of gallbladder with the help of those treatment. Okay, so body itself will dissolve it with the help of the remedies. Okay, so it is purely depend upon the patient and his condition and his uh his confidence level. And okay, so to get the treatment in other pathies, mostly in electrohomeopathy. Okay, so let's discuss about the treatment part in electrohomeopathy, remedies. Okay, what are the remedies? So basically we have S2, L1, B. Okay, starting with D5 only. Okay, C2, Ven1, G is also D5, and we have C17. Okay, rapid doses you have to give to excrete the things, and to improve the digestion we have to add S10, WE, S1 plus RE, and fifth one is temperamental remedy. Here I advise temperamental remedy, and you can add another thing here S last in D4. Remove excess things from the body which are not helpful, and you have the constipation problem. Okay, constipation also released by the, okay, by the S last. Okay, apply, you can do apply of F2, 6th, 7th. Okay, sorry, F2, WE, and you have right side. Sometimes you can get here YE also, F2 YE. Right side is negative now, so you can get positive RE. Okay, F2, A2, RE. Okay, to apply on hypochondric region, high hypochondric region. Okay, with lukewarm water or cold water. Sorry, cold, cold or lukewarm water. If there is inflammation, use cold water. There is no inflammation, initially you use cold water. Then after 3 days, 5 days, when the pain is decreased, inflammation is decreased, you can use lukewarm water, because it will give the pressure to the stones to dissolve. Okay, like we melt the anything in the hot water easily rather than cold water. Okay, so this is the initial remedies treatment. You have to take completely minimum uh, 3, 4, 6, 1 year, maybe probably. Then gradually the stone will dissolve and the patient will get relief from the cholelithiasis. Okay, this is all about cholelithiasis, gallbladder stone. Any doubts, kindly ask.